the management of hepatitis B over the last several years has become relatively, if you will, straightforward in the sense that, we've narrowed therapy down to typically a once daily regimen with either one or two medications which have very narrow adverse event profiles, and so generally patients have excellent tolerability of these regimens. The management of these patients is really, I think, most centered on adherence because of the importance of adhering, of course, to an antiviral and the consequences of non-adherence for success, namely the development of resistance. So the paradigm for management Hep B ends up being relatively straightforward for the entire sort of panoply of approved regimens. It's where the contrast is very strong for hepatitis C, largely because of the backbone of the regimen for Hep C. And of course that is an interferon-based regimen along with ribavirin, and now layer on the first generation of HCV specific protease inhibitors, and you've got multiple medications with their own specific toxicities that have to be carefully managed because they can quickly get out of hand if not watched carefully. So we have found, I think, in the past year since the approval of telaprevir and boceprevir, for instance, for the management of hepatitis C, that we've had to be intensive in our monitoring and surveillance of patients, particularly in the early going, as they receive triple therapy, not just for the systemic side effects that we originally attribute to an interferon and the anemias we attribute to ribavirin, but also specific side effects related to telaprevir, boceprevir, and again, the issue of adherence becomes important now that we have added in telaprevir and boceprevir, the first ever direct-acting antiviral agents for hepatitis C. And I can only envision as the development of new therapies for hepatitis C unfolds over the next several years with even more direct-acting antivirals. As we evolve toward that regimen, we're going to see a lot of moving targets. We're going to see an enormous need for patient and provider education around the management of these sometimes bewildering and complicated regimens until we get to a point where the world starts looking more like Hep B, which is to say a much more simplified regimen that could be done once daily, perhaps as a combination, and the great thrill for all of us, eventually we hope, will be that it can be a finite regimen that produces a cure, unlike the viruses that we've traditionally been dealing with, including hepatitis B and certainly for that matter HIV. So I think there's a considerable compare and contrast there, but I think on both ends there's going to be, I think, a great deal of education, I think, required, both again for patients and for providers.